Well, good afternoon, everybody. Welcome to the Tuesday edition of Peterborough Public Health's COVID-19, I guess we need to say twice weekly COVID situation report. Thank you for pivoting to the twice weekly format. I'm so glad the link worked for everyone. I always have that moment wondering if technology is cooperating, and I'm glad it did. Thank you for joining. Oh, I'm hearing an echo. If we can just make sure everybody's mics are muted, please. Thank you. So thank you for joining us on this rainy spring day, filling our aquifers, much needed for our flowers and plants. And as we prepare to provide an update, I did want to welcome you all with a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so with that, let us hear from our Board of Health Chair, Mayor Andy Mitchell, with some opening remarks. Please go ahead, Andy.
Thanks, Brittany. This is a difficult time for our province and our community. We have quickly gone from efforts to reopen the province in mid-February to an alarming escalation of case counts, a spike in hospitalizations, and a record high number of patients in ICUs. Several provincial actions have been taken. First, the emergency brake, then the stay-at-home order, and just yesterday, an announcement that our schools will close indefinitely. Our community has not been spared, and the numbers tell a grim story. On Sunday, Peterborough reported its 1,000th case since the pandemic began. Variants of concern are spreading rapidly in our community. More than 13% of all cases reported since the pandemic began 14 months ago have been reported just since April 1st. Our active cases stand at a very high 103, and we are following more than 370 close contacts. And very sadly, we have lost 12 souls to the disease. Roughly 35,000 people locally have received a first dose of vaccine, and in some cases a second. This includes healthcare workers, long-term care and retirement home staff, members of our First Nation communities, and seniors. The planned shipments to Peterborough in April will not be sufficient to meet the provincial target of vaccinating everyone over 60 and the other targeted vulnerable groups that have been identified. And it will be important that increased amounts be made available as supplies expand. I've painted a bleak picture because the picture is bleak. Make no mistake, though, we will recover from this wave, cases will decline, and the pressure on our hospitals will ease. This will happen, however, not through wishful thinking, but through the collective action of our residents and the men and women working tirelessly to keep us safe and to administer vaccine. Everyone needs to abide by the stay-at-home order. It is not a time to look for loopholes or develop rationales as to why the order does not apply to us. It is time to stay at home, except for essential purposes. This disease is spreading in our community through person-to-person contact. Please, whenever you can, avoid contact with people outside your household. Do not travel for non-essential purposes. Wear a mask and stay 2 meters apart. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so let's get into the numbers. So I will now invite Dr. Salvatierra to walk us through the slides of our statistics since last Thursday. Please go ahead.
Thank you very much, Brittany. So as of 4:30 p.m. yesterday, there were 103 active cases. And as Mayor Mitchell has noted, our cumulative case count topped 1,000 cases and now stands at 1,010. This is 61 more cases than just 5 days ago. Most of these continue to be variants of concern, with 55 of these new cases screening positive for a variant of concern strain since last Thursday. The number of high-risk close contacts has reached unprecedented levels and stands at 373 people, currently being followed by my team. And that's 127 more than last week. Several new cases are reporting more than 20 high-risk contacts, indicating that people are not limiting their socializing to household contacts only. This demonstrates the need, as Mayor Mitchell has already stressed, that everyone must stay at home and limit contacts to household members only right now. Heartbreakingly, we are reporting another local death since we met last week, bringing the total number of local residents who have died of COVID-19 to 12. Next slide, please. This bar graph shows that last week was a record-breaking week for us, total of 84 cases reported. Overall, you can see that the third wave is now presenting higher weekly counts than previous waves. Next slide, please. The monthly bar graph shows our cases by months. April is tracking to be another month of high case counts, perhaps the highest, as we wait to see the full impact of holiday socializing, despite those shutdown measures that were put into place. When we look at our demographics, our youngest residents represent the highest number of cases when compared to other age bands. There have been 350 cases among those aged 20 to 29 years, and 164 of those are under the age of 20. Next slide, please. The breakdown of exposures remains consistent as in previous weeks, with the largest proportion identified through contact tracing of high-risk contacts. It's good to see that there are no cases linked to travel over the last 4 weeks. Next slide, please. So far, more than 47,000, almost 48,000 residents have been tested at least once, and this is approaching almost a third of our total population at 32%. Next slide. The number of outbreaks in our community is also increasing. We have 7 active outbreaks in our community at the moment. They are in a range of settings, including congregate living settings and workplaces. All outbreaks are being closely co-managed by my hardworking case and contact management team. So things are developing quickly with our local COVID-19 situation, and I would like to share some remarks on 2 fronts. First, on our vaccination progress, and then also on enforcement. With regard to vaccination, my team continues to work through the priority groups defined in phase 1 and phase 2, and this will see home care, highest risk and high risk patients invited to PRHC for immunization. For patients who are housebound, mobile teams are being organized to take the COVID vaccine to them. While we have a great deal to be proud of, with 22.1% of the local population vaccinated with at least one dose, we can't forget that a significant proportion of those already vaccinated are healthcare workers. With a regional hospital located within our boundaries, it should not be surprising that included in that 22.1% are almost 9,000 healthcare workers, which that includes our long-term care and resident home staff. While 22.1% can be seen as an impressive number when comparing overall vaccination rates to other health units, it does mask some concerning trends about Peterborough's real need for vaccine and the lack of a sufficient supply. We know, for example, that community residents who are 60 years of age and over are at increased risk for severe disease, hospitalization, and death from COVID-19. According to our calculations, we have a total of 47,222 adults who are 60 years of age and older living in Peterborough City and County. This estimate does not include the populations of Curve Lake and Hiawatha First Nations. It also does not include the at-risk groups who are younger, but who suffer from diseases and chronic conditions that elevate their risk and who are included in phase 2 of our vaccine rollout. So 47,000 is actually a conservative estimate of the size of our population that needs urgent access to immunization. When the province opened the bookings to persons aged 60 and over last week, 32% of the 22,000 Peterborough residents between the ages of 60 to 69 had already been immunized, due mostly to the efforts of our primary care providers who administered over 4,500 doses as part of the AstraZeneca vaccine pilot. But even with that head start, Peterborough has only enough vaccine at the moment to provide close to 11,000 appointments from now till the end of April. And that falls short of the number needed to immunize everyone 60 years and over. It falls short by about 12,000 doses. That's how many more vaccines we need if indeed we wish to protect everyone in Peterborough 60 years and over by the end of April. That is why, together with our mayor and our warden, we have been advocating for a fair share for Peterborough. By doing so, no one is negating the fact that Ontario must prioritize putting out the fires that are burning in those hot spots located in the high incidence urban centers. We have never wavered in our support to allow the areas of greater risk to access vaccine first. These areas began immunizing in December, while our long-term care residents waited patiently until the end of January for their turn. But we've been hit hard by the variants of concern, and the risk of transmission has never been higher in our community. We continue to follow up with our provincial partners in an effort to ensure that the highest risk residents in Peterborough are offered their first possible chance to get a COVID vaccine. And given the limited supply of both the Moderna and Pfizer vaccines for the near future at least, I am recommending that Peterborough residents aged 55 years and over take advantage of the AstraZeneca vaccine that is now available in some of our local pharmacies and in some of our primary care practices. As of this morning, there are currently 4 pharmacies in the city that are providing the AstraZeneca vaccine. If you go to the provincial website and either allow access to your location or search by location, as of today, you will see an array of pharmacies that are located within driving distance and are administering the vaccine. The website provides you with the pharmacy hours of operation, as well as information on whether an appointment is required. New pharmacists will be continuously added to that website in the days and weeks to come. So I urge everyone to consider this option as possibly a more timely way to get a first dose. I want to thank those family physicians who are also continuing to provide the AstraZeneca vaccine to their patients. But I ask just one thing. If you choose to get the AstraZeneca vaccine sooner than your booked appointment at one of our clinics, please take the time to cancel your appointment so that you can free it up for someone else to take. And please remember, you must be 60 years or over to access our clinics, but anyone 55 years of age or over can get the AstraZeneca from a pharmacist or their family physician if they have vaccine in stock. So now I'd like to provide a brief update on our enforcement activities. As our residents grow weary of the public health measures, we are seeing growing defiance by a minority in the community. I believe several of our police partners are in attendance today and can answer more questions about their activities. Last Friday, we reported that we served a Section 22 order to close a barber shop, refusing to comply with the provincial shutdown orders. That premise is closed, and we continue to have our public health inspectors monitor the situation closely. Now, to provide us with an update on enforcing the COVID-19 measures in Peterborough County, I am pleased to introduce OPP Officer Chris Galiza. Over to you, please, Chris.
Thank you, Dr. Salvatierra. Just a brief update from the weekend. Since actually 12:01 a.m. on Thursday the 8th, when the stay-at-home order came into effect, the Ontario Provincial Police in the county received 13 calls for service. Officers attended each of those complaints. They were listed in order of priority. At the end of those investigations to date, no charges have been laid. There are 2 current active investigations ongoing. So that is the update from the past weekend.
Okay, great. Thank you very much, Officer Galiza, and also thank you, Dr. Salvatierra, for that update. So now we will give an opportunity to our local elected officials, and I believe we have both of our municipal representatives with us. So I'd like to start with our Mayor, Diane Therrien. If she has some comments, we welcome them, and I'm happy to put you up on screen if your camera's cooperating.
I think it is, Brittany. Thank you. Thanks again to yourself and to Dr. Salvatierra for all the work that you're doing, and Chair Mitchell for always opening these with a lot of words of wisdom. I'm not going to repeat what's been said. I think we're all on the same page here, advocating for more vaccines for our region for all of the reasons that were mentioned before. We're continuing to work together on that front. And there was some questions about the closure of the Simcoe Street and other basketball courts over the last week. And that was done to protect people. I know that it's a fine line between letting kids and youth have access to outdoor spaces to get that physical activity in, and the health and safety of the general community. And so that was a tough decision to make, but they're going to be closed for a little bit to make sure that we are limiting the spread in that type of facility. Other than that, I'm happy to remain on the line for questions after, but thanks again to everybody for all your work.
Thank you very much, Mayor Therrien. Okay, so let's now invite County Warden J. Murray Jones to share his comments and perspective from the county. Please go ahead, Warden Jones.
Okay, Brittany, I hope you're hearing me okay, and thank you very much. I think Dr. Salvatierra pretty much said most of the remarks that I wanted to make, as well as Mayor Therrien, and we certainly vowed to stick together as a region on this, and as we've said, to make sure we do indeed get our fair share, and I certainly stick by those words, and I still ask our MPs and our MPPs to do whatever it takes to make sure that we are indeed looked after. I want to say thank you to all the volunteers and the staff who are out there administering the vaccines. I've had the opportunity to see the action at Evinrude Center, and yesterday even up in Apsley. And I've got to say, all the staff and the volunteers just have a wonderful attitude, the friendliness, and it really does make you proud. So I congratulate everyone for doing things the right way and for the right reasons. And I guess it's still a little frustrating. We're trying to do the right thing, but as you look around sometimes, you still see a whole lot of cars in driveways, it seems, on a regular basis, and not necessarily everyone is listening to the rules, but I hope we can all kind of look in the mirror and say, let's get this done and do the right thing now so that we can enjoy the summer. We keep putting this off, but I'm sorry, we gotta all work together. Anyway, that's it for us. Peterborough County is alive and well, and we're trying to deal with this with a smile, and I hope everyone else is too. So please remember, we're all in this together. Thanks.
Thank you very much, Warden Jones. And I understand we also do have MP Mary Monsef on the phone joining us today. So if you have any comments, MP Monsef, please go ahead.
Thank you, Brittany. I'm having some technical glitches, but grateful to be able to join you via telephone. Hello, colleagues. Bonjour, Anin, salam alaikum. Many thanks to Mayor Mitchell, Chair of the board, and Dr. Salvatierra, and every single one of our frontline care workers for their tremendous and difficult work in difficult times. I would like to take this opportunity to wish a happy Ramadan to all the Muslims in our region and across the country. This is the second Ramadan in COVID, and the ways to remain safe and continue to observe this very important practice. We're getting questions like, does having a COVID-19 test break my fast? The answer is no. We're getting questions about, does getting the vaccine break my fast? The answer is no. And there are many more answers to get. If folks need it, feel free to reach out to my office. We'll also share the information we've received from the Canadian Muslim COVID-19 Task Force on how to observe Ramadan safely. On vaccines, I'd like to share that as vaccine supplies continue to stabilize, we're working around the clock to get as many vaccines to the provinces and territories as quickly as possible so they can distribute them to folks across the country. We're scheduled to receive 1 million doses a week of the Pfizer vaccine until the end of May, and 2 million doses a week in June. In total, we're expected to receive at least 44 million doses of COVID-19 vaccine from Pfizer, Moderna, and AstraZeneca by the end of June. Already, these vaccines are saving lives, keeping countless communities safe. We're transmission rates among our most vulnerable elders dropping, but as Dr. Salvatierra has said, we face another wave of the pandemic, and until everyone has access to a vaccine, we must all continue to do our part to curb the spread of the virus. This means staying home unless absolutely essential, only physical contact with our immediate households, following local public health guidelines, and using the COVID Alert app. If you have to go out to get food or get your vaccine or to work in essential jobs, make sure you wear a mask, maintain physical distancing, and wash your hands often. Being away from your loved ones is difficult, but staying apart right now is the best way to protect one another. We will get through this. And on the topic of in-person school closure, before I wrap up, with the announcement from the province yesterday regarding schools being virtual after the April break, I want to remind everyone about the Canada Recovery Caregiver benefit. This provides income support of $500 for up to 38 weeks to employed and self-employed individuals who are unable to work because they must care for their child or children under the age of 12 if their school or child care center is closed due to COVID-19. This benefit is also available if you're unable to work because your child has COVID, is self-isolating, or at risk of serious health complications due to COVID. To apply, you can go to canada.ca/COVID-19 right now, and you can do that, or you can reach out to my office, and my team and I are happy to assist you. That's it for me, Brittany. Thank you.
Thank you very much for that welcome update, Miriam. Okay, so now we have an opportunity to hear from our reporters on the line, and I've counted, I think, about 5 of our media guests have joined us, which is great. So I will invite to start it off Danelda Fraser from the Havelock Rail. If you have any comments or questions, for Dr. Salvatierra, please go ahead.
Good morning. Well, I guess it's good afternoon. Yes, I've been hearing rumors that some of the appointments are being made and then no one shows up for them. Is that really happening, or is that just a rumor?
Don't know for certain, Danelda. I hadn't heard that we were getting no shows in our clinics, but I do believe that one of the problems when people are having to wait longer is that you do get a higher risk of no shows. And so for that's one of the reasons why, for example, we are very careful about opening up new vials of vaccine, and we have a list of people who we can call in or use the vaccine up at the end of the day so that we don't have wastage. But it is a reason why I have asked people, and if you do end up getting vaccines somewhere else sooner, it's really important to cancel that appointment, because no shows do put us at a risk of wasting vaccine. We use the Moderna and the Pfizer vaccines in our mass immunization clinics. Once they're thawed, they have to be used. So it's really important that we are all in this together and we all help to protect that very scarce and valuable vaccine supply.
My other question is, people that are under the age of 60 that have autoimmune diseases, can they go ahead and book an appointment somewhere?
So anyone 55 years of age and over can book an appointment at a pharmacy or get their vaccine through their family doctor if their family doctor is using it. We are currently now identifying people at higher risk. And some people with these conditions might be included in those groups. They may be contacted by their physician and they may be invited for an appointment for a vaccine at PRHC. So if they have questions, they should have that conversation with their primary care provider.
Okay, thank you very much. that's all from me.
Okay, great. Thank you, Danelda. So glad you could join us today. Okay, let's hear from Paul Rellinger from Kawartha now. If you've got some questions for Dr. Salvatierra, please go ahead.
I do, Brittany, and thank you so much as always. Couple quick things, Dr. Salvatierra. You mentioned the vaccine number percentage of 22.1%. Do you know what that represents in number of people offhand?
I do know what it represents, Paul. I have those numbers. I don't have them at my fingertip.
Okay.
But they are available. They're part of a Public Health Ontario report that was published on Friday, and we certainly can get that to you.
If you could, that would be great.
Yeah.
Thank you for that. I take it, I know the answer to this, but I just want to confirm it. You're talking about the vaccine concerns about getting enough vaccines. So I take it there's no imminent vaccine arrival dates or anything that you're aware of coming up?
Well, we do get vaccine. We get Pfizer vaccine every week.
Right.
And we get Moderna vaccine twice a month. So I have estimates of what will be in those shipments.
Okay, so but even with those expected arrivals, we're still in the situation clearly that you described.
That's right, because we use those shipments in order to open up clinics. So if I know I have this much vaccine expected next week, I will enter so many appointments in the booking system. So the system is actually linked to the amount of vaccine that we anticipate having in our freezers. And so that's why we can't open up more appointments if we don't have more vaccine.
Right. Okay. Thank you for clarifying that. Regarding the unfortunate news of another death for our region, I know you can't say too much about it, but is that death related to an outbreak or was it not related to an outbreak?
Yes, it was related to the Empress Gardens outbreak.
Okay, and so that would be the second death that's been related to that outbreak, correct?
Yes.
Okay, thank you. And then one more thing, and I seem to be the one who always brings it up. Regarding the barbershop and the, what kind of happened there and they were forced to close. Again, Dr. Salvatierra, and I don't mean to beat a dead horse, but again, no charges. Clearly, this person opened in contravention of the rules, right? And I don't know. I guess they got a warning and don't do it again.
No, actually, you're guessing wrong. They have been charged, and I believe Julie is on the call today. I'm wondering, Julie, if you'd like to respond to Paul's questions about the barbershop.
Hi there, everybody. Good questions, Paul. So I will just clarify that prior to the issuance of the Section 22 order, Peterborough Public Health did issue 2 charges to the barbershop. One was for failure to comply with the continued Section 7.0.2 order. So that's essentially failing to comply with the Reopening Ontario Act and the associated legislation there. They didn't close. They refused to close. And when we did go to lay that charge, because of the openness of the operator and the admission of the fact that the operator had still been taking business and conducting business and had no intention to stop, the operator was also charged with obstruction by our inspectors under the Reopening Ontario Act. So 2 charges were laid in that circumstance.
Oh, and again, I apologize if I should have known that. I wasn't sure if that, I saw the release, but I don't think at the time the release came out, those charges were made clear. So thank you for pointing that out. And that's all the questions I have, Brittany, and thank you, Julie and Dr. Salvatierra.
You're welcome, Paul.
Great, thank you. Thank you both for helping field that question. Okay, so let us hear from our friends at Trent Radio. Rob, if you've got some questions for Dr. Salvatierra, do go ahead.
Hi, thanks, Brittany. So Dr. Salvatierra, last week, I guess on Thursday, I'd asked if you had any thoughts around the latest shutdown order, and specifically around if there was anything you were hoping to see in the order, that like any additional measures that weren't there. And you mentioned that you hadn't had a chance to review the regulations, or maybe they weren't quite available at that time. So I'll ask again. Is there any measures that you think would be important or helpful at this time that aren't captured in the current shutdown order?
That's a fair question, and I think that my answer is one that is consistent from the very first time the province has introduced restrictions, and that is that I would like to see stronger enforcement of the travel restrictions. That continues to be, I believe, an area of weakness in our provincial shutdown or stay-at-home orders. That is the lack of enforcement of travel restrictions, because that is the only way that the virus moves. And the fact that we are witnessing a surge now of these cases, which come to us after a holiday weekend where the shutdown order was in place. So it came into effect midnight of Saturday, so Saturday morning of that long weekend. And we are seeing, we have lots of evidence that people were socializing and moving about. And now we're dealing with this horrible, horrible surge. And so to me, that speaks to the need for stronger enforcement to ensure that people do in fact stay home and not travel. And that's what's been missing all along from as far as I'm concerned.
Great, thank you very much. And just to clarify, that's travel within Ontario that you're referring to?
Yes, travel within Ontario.
Wonderful, thank you. I guess my next question, just with the increase in cases that we're seeing right now, you had mentioned that the number of close contacts that we're seeing is very high. I think you said there were some cases where there was as many as 20 close contacts from a case, which is definitely concerning. Is that mostly from socialization, or I know in other jurisdictions we're seeing a lot of concern around large numbers of contacts in workplaces, for example, in manufacturing settings or in warehouses. Is that happening in Peterborough, or is the biggest concern still around socialization and spread that way?
Well, I don't have the granularity of details. I know we have 3 current outbreaks in workplaces in Peterborough, and I can't comment as to how many close contacts were identified through that. But we also have a school, and we also we certainly have other examples where there were events occurring. I think the difference might be that because we're dealing with a variant of concern, we're having to be much more precautionary as to identifying people as high risk close contacts. So the threshold for being identified as a high risk close contact is lower now that we have the variants of concern, because they are 60% more transmissible. So that is driving as well the numbers of high risk contacts up. I mean, to think, we are at 373 people as high contacts right now in Peterborough. We've never had that many high risk contacts.
So it's I guess the message there is that the concern is kind of independent of where it's coming from.
Well, I think the answer to your question really is that any socialization is going to potentially put someone at risk, more so than ever. So and so that means that we expect to see more high risk contacts per case. And especially if that case is not staying at home or working from home, there's more potential for high-risk contacts to be identified.
Okay, great. Thank you very much. I think that's pretty clear. Thank you. That's everything for me.
Thank you, Rob. Thank you for your great questions. Okay, let's hear from Matt Latour from Oldies and Freak Radio. Go ahead, Matt.
I've got two questions for Dr. Salvatierra and one for Julie Ingram. I'll start with Dr. Salvatierra. The first has to do with, I saw this morning down in the US, they recommended a pause on the Johnson & Johnson vaccine after some incidents of blood clotting. I know this vaccine's been approved here in Canada, but I don't believe we've received any yet. Is this concerning, ahead of eventually some shipments of this vaccine coming to Canada?
Well, I think that's why we do the surveillance so closely, and it provides us with really good information like this. I'm not surprised that the same rare autoimmune disorder that we've seen with the, or we believe we've seen with the AstraZeneca may also be present with the Janssen vaccine, because they're both viral vector vaccines. They both use an adenovirus as the way to get the protein into the cell. And so it may be linked that the trigger for this autoimmune disorder is coming from the same place in the vaccine. So if that is the case, we will definitely need to ensure that people are aware. We may need to restrict the way we use the vaccines. I do believe that Health Canada has been looking at the data with AstraZeneca, and I do believe that NACI will be making further recommendations on AstraZeneca and potentially even on the Janssen vaccine as early as the end of the week.
Perfect. And my second question had to do about local outbreaks at Empress Gardens, at the workplaces, at Thomas A. Stewart. Do you know how many cases combined are from these, I believe it's 7 outbreaks right now?
I can find out, Matt. I don't have that information at my fingertip, but we do keep track by outbreak. So I'm sure that's something we can get to you.
Perfect. Thank you. And for Julie Ingram, you had mentioned that the barbershop had been charged. Is it possible as well, if something like this happens in the future, that customers of a business that are opening in defiance could also be charged?
Yeah, it's an interesting question, Matt, and we've done some research into that. There's no real provision for charges under the Reopening Ontario Act, but there would be provision for charges for individuals under the stay-at-home order, because it wouldn't be attending a business that is supposed to be closed is not one of the permitted reasons for breach of the stay-at-home order. So an individual, yes, could be charged under the stay-at-home order.
Perfect. Thank you both.
You're welcome.
Great. Okay, thank you very much, Matt. So let's move on to Bill Hodgins from Peterborough This Week and Mike Kawartha. If you've got some questions for Dr. Salvatierra, go right ahead.
Yeah, just two quick ones, because people are asking a lot of my good questions, so that's cool. The first has to do with situations like the basketball court and the barber shop. Were they complaint driven, and are investigations started that are not complaint driven, that you just walk around and find?
I think that's a good question for Julie to answer. Julie, are you able to give him an answer on that?
Sure, I can. That's a great question, and part of me wishes that we had some more time to walk around, but I actually can't speak to the basketball court situation, so I probably will defer that to Inspector Lyons. However, I can say from the barbershop situation, that was indeed a complaint-driven report, which is why we do encourage complaints to be submitted to Peterborough Public Health. We have an online complaint form. Every complaint does get investigated. We do take it very seriously. So Inspector Lyons, I don't know if you can take the basketball court situation. Thanks.
Yeah, thanks, Julie. For sure. To answer your question, essentially, we do a combination of both. Officers on patrol are aware of the legislation, and if they openly see a situation where people are defying the order, they will approach. But the basketball court scenario in particular was complaint driven. We did receive a number of complaints. There was 4 attendances there to try and make that situation work itself out, so to speak. But unfortunately, it was met with non-compliance. So that measure was taken to consult with the city to remove the hoops from the court to try and alleviate any future issues.
Great. And one more question, I guess, for Dr. Salvatierra. And this is sort of out there. In terms of the mass vaccination clinics, are there situations where people are showing up at the end that don't have appointments, that are hoping there are a couple left over or anything like that?
I have heard of that occurring in our clinics. So, people are aware that we are hoping not to waste any vaccine. So good on them for having the initiative, but we do keep a list at each clinic of people that we can call in to be immunized. And the guidance from the province is that we only use any leftover vaccine on someone who is eligible, but maybe doesn't have an appointment, or the next eligible group. We can't just immunize anyone. And when that happens, because it isn't, we do our best, but sometimes if you're in a rural area, for example, and you just don't have enough people around, sometimes we have had to immunize people who were not the next eligible group. And if that happens, we post it on our website. So we do publicly report on any administration of the vaccine that is done to someone who is not currently eligible, and you can find that information on our website.
Great, thank you. That's it for me.
Okay, great. Thank you very much, Bill. I see that Paul Rellinger has a follow-up question, so I'll invite you to ask that, and then we'll move on to Jessica Nisnik and then Joelle. So go ahead, Paul. And if you also noted, my wonderful team has posted the link to the Public Health Ontario report that answers your question about the number of residents covered in the 22% vaccination rate.
Oh, thank you for that. And sorry, I could have waited to the end, but a quick question on the barbershop situation again. Were there monetary fines attached to those charges as well?
Maybe Julie has an answer to that.
Yeah, there were. Both of the charges that were laid were set fines. So the failing to comply with the continued order was $750 plus service charges, and then the charge for obstruction was $1,000.
Thanks so much for clarifying that. I appreciate it.
You're welcome.
Okay, great. So Jessica from Global News, if you've got some questions for Dr. Salvatierra, I'll put her up on the screen for you and you go right ahead.
Thanks, Brittany. Hi, Dr. Salvatierra. Okay, so I know that I don't really know how vaccines are being allotted. So I know they're going to hotspots, but you said before the reason that we're short, one of the reasons is because we have such a high senior population. Mm-hmm. So is that not being taken into account? Like how are they being allotted, and why isn't our senior population being taken into account for us to receive more?
So I'm not completely sure, Jessica, of all of the information that's considered by the Vaccine Task Force when it makes its allocations. I know, for example, that when we first started getting vaccine at the end of January, there was a bit of catch up. They were giving us additional vaccine to try and catch up because we were one of the last 14 public health units to receive vaccine. I know, for example, as well, that they have given us allocations related to our First Nations communities. So there's been some vaccine that has come to us because of the fact that we have 2 First Nations that are part of the phase 1 priority groups. But then typically what is shared with us is, or when they explain to us how much vaccine we're getting, is it per capita calculation, which is why I worry that the per capita calculation may not be sensitive enough for Peterborough and areas like Peterborough, where we're balanced or skewed towards an older population. And so that's one of the reasons why I am seeking an opportunity to have that conversation with the province, so that I can understand better how the allocations are being made, and also argue on our part that in fact we may need a different lens to determine what our actual need is versus what just our per capita need would be.
Okay, thanks. So interesting. One of the last health units to receive the vaccine, but we have the highest elderly rate, which is the most at-risk population. That's frustrating. So Dr. Salvatierra, as far as canceling appointments, I did receive an email from someone. They didn't know how to cancel their appointment and they were afraid it would get wasted. So how does someone cancel their appointment?
I believe it can be done online, Jessica, or by phone, but let me have someone look into that and we'll get back to you on that.
Okay, yeah, I mean, I don't know how else it would be other than online or by phone, but she said she couldn't get through. Do you want to let us know? Do you know the last pharmacy that's been included in this latest round?
Yes, I do know that, and it's I believe it's the Guardian on High Street. Does that make sense?
Guardian on High. On High, I can just think of the Shoppers.
Okay, then if you go on the website, Jessica,
it'll say,
and it will give you all of the, and there are 4 in the city. They're all in the city right now.
Okay, perfect. So let's see here. The 12th death. Do we have an age or a gender for that?
I don't, I'm sorry. And I see that Sarah has put the information on how to cancel a vaccine appointment in the chat box.
Perfect. Oh, okay. I think yeah, and if I'm guessing, and I shouldn't guess, that the Empress Gardens death was the other person that was transferred to the ICU or transferred to the hospital. Do we know that?
Sorry, I don't have that information.
That's okay. I think that's it for me. Thank you, okay. Dr. Salvatierra.
You're welcome.
Okay. Thank you very much, Jessica. Okay, Joelle Kovac from the Examiner. I'm sure you've got some questions for Dr. Salvatierra, so please go ahead.
Yeah, did I understand you correctly, Dr. Salvatierra? Were you suggesting that people 55 and over leave the city to go and get a vaccine if they think they can get it? You said if you could go within driving distance, then please do. Is that what you meant?
Yes, I did mean that, Joelle. There are pharmacies that are just outside of Peterborough. There's some in Lindsay, for example, which might be close to where people live. So there is no requirement that one has to stay within your public health unit. In fact, as of last Friday's report, we had immunized 2,000 people who do not live in Peterborough, but who actually live in the Haliburton, Kawartha, Pine Ridge health unit. So we do expect that people will be making choices as to whether maybe some place is more convenient because it's closer to where they work rather than where they live. Or maybe the hours work better for them, so it's worth the drive for them. But there is that opportunity to access vaccine where it is most convenient.
Okay, so that very first weekend when it was when they were starting to vaccinate, I think it was 60 and older in Toronto, the advice was to stay in Peterborough, right?
Well,
but now,
I'm not suggesting that people drive to Toronto, but I'm suggesting that if you go into the website for pharmacies, if you allow the website to access your location, so your postal code, they will give you about 20 pharmacies that are all within driving distance, depending on your postal code. So that's the way the website's been set up.
Okay, that's a lot clearer. Thanks very much. In the press release that was issued on Friday about the barbershop, it was mentioned that there has been 8 cases of COVID related to a personal care setting. There was no more detail. Is that one of the workplace settings? And why can't you tell us more about that?
Well, there really isn't a public health reason to share the information. We've managed that outbreak. It is related to a personal service setting, which is why we are concerned about the barbershop. I mean, for a personal service, you need to get close to people within that 2 meters distance. So that it is a high risk situation. And the fact that we have another personal service setting right now that has at least 8 cases involved is an example of why it is so important for that barbershop to close.
Okay, is that one of the workplace outbreaks or is it not?
Yes, it's the other personal service setting is a workplace.
Okay, that's great. Is Inspector Lyons still on the call?
Yes, I am.
Yes.
Oh, that's
Yes.
fabulous. I'd have a couple of questions for him. While we're talking about haircuts, are police going to set up a haircut service in the station this time around?
No.
Okay, regarding the charges on the weekend at Confederation Square, I read that there was 5 charges. But there was no more detail about that. Who gets charged in these instances? Is it organizers? Is it like there was 250 people there, but 5 charges? Is there a way to offer a bit more detail about how that's?
Yeah, so typically in that situation, we tend to look to see who is, again, you're right, the organizers, because essentially it's those folks that are bringing the mass group to the actual location. So what we're hoping to do by that is by leading by example and showing that if they're going to organize these rallies, then they have to accept some responsibility for what happens as a result of that.
Okay, I presume it's an $800 charge. Is that right, or?
Yeah, that's correct. It's the $880 with the victim surcharge that's added to it.
Okay, that's great. I think there were more. Can you tell us much about that tailgate party that happened at the top of Armour Hill? It sounds like there were more charges there than there had been at Confederation Square, and I wondered about that. Was it a bigger gathering? What happened?
Well, essentially in that situation, what you had was you had a group of approximately 20 young adults that were gathered up there. They basically had a party set up. It was they had lawn chairs. They had some had open alcohol. They had loud music playing. It was just an act of total defiance of the actual legislation. And obviously, in each situation, it's a case-by-case basis. Each officer has their own discretion on what to do and whether or not to lay a charge. And in that particular situation, they felt that it was relevant, and they identified 9 individuals that they charged under the ROA, the Reopening Ontario Act, which were $880 tickets. There was also a 1 liquor ticket issued, and there was also 2 Highway Traffic Act tickets issued.
Okay, and that was on the weekend? Was that during the day?
Correct. That was on Saturday, just after the, and unrelated to the City Hall rally. That was just another gathering that had occurred up on Armour Hill, and we had complaints in the past, or rumors that there were gatherings up there, and it just happened that we had COVID detail working on Saturday that were able to attend there, and that's what they found. They found, as I said, 20 individuals up there in open defiance of the legislation.
So they've responded to a complaint. It sounds like someone had called.
Correct. Yeah, for the majority of the calls that we are dealing with, and that the details are going out on, a lot of them are complaints that we're receiving through many different avenues of our social media or just through our actual the non-emergency line as well. They're also doing trying to be proactive in going to some locations to try and see if they can maybe thwart any issues or problems. You know, on top of the regular detail that they did, they also did 22 compliance checks under the Quarantine Act, which they had to go and check on individuals that are under a quarantine order, and that's a normal part of their duty.
Okay, and is that necessarily in response to a complaint, or is that because you're doing regular checks?
In those particular cases under the Quarantine Act, those come through initially through the CBSA at the border, and they get filtered down to the municipal and provincial police services to make sure that they're compliant with the order that they're to quarantine for the 14 days after returning.
That makes sense. Thank you very much. That makes things much clearer. Okay, that's it.
Okay, thank you. And I did just want to also mention, Joelle, under the stay-at-home order, traveling for medical appointments is one of the few reasons you're allowed to travel. So that would, you know, if someone does have a vaccination appointment within driving distance, that would still be allowed. Okay, so with that, that brings our media briefing to an end. And I would just like to also mention that we are making sure to shift the data that we present on the different days so it's consistent. So you'll see on Friday when we return, we'll have current numbers relating to our vaccination progress, the wastewater surveillance reports that are generated weekly, and our case incidence rates. So if you were looking for those today, you will see those on Fridays going forward. Okay, with that, thank you very much, everyone, for attending. Appreciate our elected officials who were able to join us today, and please stay safe out there, and we look forward to seeing you back here on Friday. Thank you.
Thanks, Brittany.
Thank you.
Thank you, everybody.